Marissa Ayala. That was the name of the girl. She was around 15 years old, and she had a life-threatening disease. She belonged to a poor family. The mother was 35 years old, father was around maybe 37, 38 years old, and they went to different doctors, and it was a terminal illness which could not be cured. So the only way they could try out was that if the parents have another child, okay, and if the bone marrow of the newborn child matches the bone marrow of the sister, then by a bone marrow transplant, she could have been saved. Marissa Ayala could have been saved. Okay, so they are from a poor family. Mother is 35 plus, father is 37, 38. There's no other way out. In this situation, what should the family decide and do? Is it clear?
Yeah. So, in my understanding, it should primarily need to be a combination of two factors. One is that what does medical science say about the possibility or the probability of the newborn's bone marrow being used for treating Aranya. I'm sorry, I didn't catch the name, but yeah. And secondly, again, as you mentioned, they are from a poor family. So, what also matters is that whether or not they are financially and mentally ready to raise another child, because it could go wrong to an extent that if they do plan on having another baby, and let's say the bone marrow doesn't match, and then they are not able to save their elder daughter, and if they're not financially well enough to raise another child, and then that child also faces issues, health issues or something, and then they're not able to manage that too, so it could be a very very bad situation for the family and their children. So that needs to be seen. And as I mentioned, what is the probability of the bone marrow being matched? Lastly, I would also add the fact that from the looks of it, this seems like a very expensive surgery, because if it's a bone marrow transplant, as per my understanding, it's one of the most expensive surgeries in medical science. So does the family has the financial backing to even consider doing that surgery even if the bone marrow matches? So I think these are the points that need to be looked upon before making a decision.
I think
Like,
that this includes a lot of discussion from the mother and father themselves to understand if they want to raise another child. And as we all know that children are very dear to parents, so I don't think making another baby and trying all possible ways to save their firstborn would be a hesitation. But yeah, as we know, they are poor, and so there are chances where the bone marrow might not match. So I think either ways they were going to raise one child, so the other child won't be a problem then if the bone marrow doesn't matches. Also, if they are unable to see, as once pointed out, there are two ways. If they can have the bone marrow transplant surgery, if they have the money, then I think they should go give it a try and try to save the elder one's life. And also, but if they do not have the money, and we also see that in the rural areas people often sell their organs at a price so that they can compensate for different medical requirements, so that could be a case. So then I don't think there is any point to go through another baby, and they could just they could just stay with Marika and enjoy whatever time she has left with her disease on this. Yeah.
There are several things that need to be considered to even discuss this. Firstly, if they do have the finances to carry out the bone marrow transplant procedure, only then this discussion should be taking place. And if they can, then there's the financial health aspect of it and the physical health as well. Like the mother is 35 years of age, so everything needs to be considered whether she can have another child or not, if it's safe for her to have a child, because after the age of 30 the risks increase to carry a child. So that needs to be considered, because if that's a huge risk on her health, then the father wouldn't want to lose both his wife and child. And if it's safe for them to conceive a child, then they because of very emotional reasons, they would want to try for another child and raise another child to help their firstborn in every way they can. And I think it would, um, if it does work out, then they would have a very bonded family, and it there are no cons to it, except for the fact that they will be struggling financially even further. However, if it doesn't work out, they will have their second child to support them through this huge emotional loss of their firstborn.
What I believe is we should also look at the perspective if the mother is actually going for a second child, and since the first child is already suffering from a terminal disease, like who will look after the first child? Since the mother, while in her labor, she won't be able to look after her first daughter that well. And the father, I'm assuming if he goes to office, then also he won't be able to devote that much time. And since they don't have that much financial affluence so as to appoint a nurse to look after the daughter, that also needs to be taken into consideration, because if she's suffering from a chronic disease, then there needs to be constant surveillance for her as well, and that point needs to be brought up. And another point that I need think that needs to be brought up is the ethical consideration for such an action. You're basically raising a pig for slaughter. Like it's the phrase is just like that because you're essentially having a child in order to transplant the bone marrow from that child to the first child, and it raises ethical questions as to why, as to how such an action can be done. Like in many US states, we have seen that abortion is illegal and that you cannot take life away uh, from a person. And the similar consideration needs to be brought here as to if a person is being brought to life only to be a sacrificial lamb for some other person.
Mhm. But I
Uh,
don't think that the bone marrow transplant would kill the newborn. I'm not aware of the facts,
yeah,
but
that's what I was going to ask.
yeah, and also the
But
abortion part that you're talking about of the United States, I don't think that is particularly correct to influence a woman's decision of whether they want to have a child or not. And it's nowhere
no,
government's decision to bring
that was just
uh,
what I meant to say was that in the US states, in the some of the US states, like there is no option for abortion. That is that you cannot take away the life of someone. So that was the analogy that I was drawing there. Like obviously, a bone marrow will not kill it. Maybe not kill the baby, but it will severely restrict its movement. Like a bone marrow is necessary for a person in order to function properly.
yeah, but bone marrow makes up, no, it every 15 days or 30 days, I think the body makes a new bone marrow. So it's regenerating. It's not like something you take out, it won't grow back after the some time. So
Oh, if
taking
that's
out
the
the
case, then
bone marrow, yeah, it's not
okay.
an
If that's the
organ that we're
case,
taking out. It's regenerative. It's a fluid in the bone.
okay,
So
if that's the
that
case, then obviously that consideration is can be ruled out. But my initial consideration, if the mother is in labor, then who will look out for the child? Then that still needs to be looked at.
yeah, that's a valid point.
So I think another thing that needs to be taken into consideration is the prognosis of the treatment. We discussed that a matching bone marrow or a one that is basically matches to save the elder one's life would basically save her life. But what would be her life after that treatment? Is it going to be normal, or is it going to be the case wherein she's very much vulnerable to chronic diseases, and there is a very significant compromise on the quality of her life, or some issue with her mobility, some nervous system issue? So that also needs to be taken in consideration, because even though it's important for the life to see their daughter grow and live, but just saving someone knowing that their future is going to be having a lot of suffering is probably not a very good way to proceed with.
Yes, I agree that since they're already poor and they're not very affluent, and if the baby's bone marrow matches with Marika Laya, so there'll be a family of four, and then the financial burden will increase exponentially, and it would be affecting the bringing up of upbringing of the child also, um, more mentally as well, because then it might be declared to be a burden, and what the family culture and the environment might be toxic. So why to ruin a human being's life just to save the the elder daughter?
Would anybody like to add anything more? Okay, Mohit, please summarize. Hello, Mohit, please summarize.
Yes, sir. Okay, so we started our discussion with how the family needs to take a sound judgment based on all the facts that are available, since having a fourth child may put the family on a financial burden, and since the operation is not sure to be a success, then that also needs to be put into consideration. If and We also have to look at the emotional uh, from the emotional aspect as well, because losing a first child is going to be traumatic for the family.
Ishita, please summarize.
Um, so in this entire case, I think financial and physical health is something that should be considered for the entire family. Their finances are anyway at a crunch, so understanding if they can afford what the future holds for them is very important. And their physical health of the mother, if she can deliver another child, as well as the physical health of Marissa, if she will be a fully functional human being if the procedure is successful, and the chances of um, the bone marrow matching to Marissa of the second child is very important, because if that doesn't work out, it's going to be very traumatic for the family, and the second child which is born into the family might feel neglected. However, it also might turn out to be that it might be a huge support to the family. So I think most of us can agree that having the second child seems like a more likely choice that the family might make.
Shaurya, please summarize.
So from the discussion, I think we figured out that getting another child would, of course, add some support to their family in case Marissa does not make it, but they would have someone to fall back to take care of them. Then it was discussed if it is something that would affect the other child, and if it would, of course, if it would actually increase the likelihood of her life, or would it be difficult for her to live on even if the operation is successful. But the finances was also a problem, because if a lot of their money is expended, if they're not well off in treating their firstborn, it would make their life considerably difficult for the other child as well, and put a burden on the family for later on.
Okay, fine. I think again we have covered most of the things. See, one thing that we should also consider is that there is anyway there is a lot of sibling jealousy, envy, uh, as to who the parents love more, or who is the favorite child and all that. In this situation, if both were to survive also, and later on the younger child gets to know that she's come here only to protect or save the life of the elder child, then the reaction can be one of joy, or it can be one of sorrow also, depending on how the child is brought up. The other thing is that money part that we discussed. I don't know why none of you said that money can be arranged through crowdfunding. I have seen that happening in one college where the chaukidar there, his wife had cancer, so they collected around 15 to 20 lakhs for him. He's been working there for a long time, so a lot of people contributed a small or big amount. I also know of a person who was from a well-to-do family, but they had over a period of time they were sort of middle class, and he needed around 40 lakhs rupees for cancer which had relapsed, and they were able to arrange 45 lakhs rupees for him through crowdfunding, through relatives and through friends and whatever. So that thing could have come up as far as the finances were concerned. This case is about organ harvesting, cloning, and all these kind of things. That how would you feel if you are brought into this world only to save an elder sibling? The obvious thing was about the mother's age and whether she can conceive at that age. What are the chances of a good conception? What are the chances of a safe delivery? Then what are the chances of bone marrow matching? So everything is very probabilistic, and the chances of having a child and it being able to help bone marrow matching, and then the transplant being successful, that also is an issue. Then the pain during bone marrow transplant, that is also an issue because it will be a very small child. Process would take at least a minimum of 9, 10 months and maybe more. So whether this elder child will survive till then or not. So these are all the issues that mostly you discussed, so that's fine. Do you have any questions on this case?
So, like, I had one question. Like, I made a wrong point then. So, how is that going to affect the overall discussion from my part? Like, how will they grade it?
Since it's a technical thing, it's okay. I don't think if you have just made only that one point and that is wrong, then it goes against you. But since you talked about few more things, and this was just a technical error, I don't think that there is too much importance.
Okay, sir.
Anything else on this case?
So what exactly are the effects of a bone marrow transplant on the child that it's being taken from? Like, if you're aware, um, in my understanding, obviously that child
Basically,
is his life,
basically,
but then yeah.
basically the stem cells come from the bone marrow, as far as my understanding goes. So the stem cells are there in the umbilical cord and in the bone marrow. So the bone marrow matching means most of the fluids, most of the constituents of body fluids are matching. So the transplant can be done and it can be hoped that it will be successful. It would basically be the pain because the bone marrow lies inside the bone, right?
Hmm.
So you have to take it out from there. I think they do it via some injection. The other thing that is to be looked into is that a lot of safety has to be maintained. They are the transferer and the transferee both have to be in a sanitized environment. Nobody can go near them for a long period of time, on 15 days. So only one attendant can go in to do whatever daily work. That too in a fully sanitized environment. Otherwise, the chances of infection are very high. Apart from that, the pain that one has to undergo, and remember that it would be a newborn child. So very feeble, very weak, and how much it will be able to take the pain, that is also a moot point.
Right.
I think something came out about abortion, no, during the discussion. What are your views on abortion, if I may know? What do you think? Suppose maybe it's a 4-week fetus and there are compulsions to abort it. What is your feeling about it?
There
What do
is
you think?
compulsion to abort it.
Yeah, there is compulsion. It may be a child or pregnancy out of wedlock, out of extramarital affair, teenage pregnancy.
Okay, okay, got it. Oh, I
Like,
think
sir,
it completely
yeah,
depends on the woman who is going through the procedure. So if she thinks she is capable of becoming a mother, she can go through the pregnancy. And if she thinks she has to let go because she cannot financially support it or even emotionally support the child, I think she does not have to go through the pregnancy procedure.
Yeah,
If she
I would.
can support,
But emotionally, she cannot know. Financially, she might be from a well-to-do family, but she might not emotionally willing to become a mother. So I don't
so,
think there is some
so then she
foundation
should
on her
abort.
to go through it. Sir, if she cannot raise the child, why? What is the point in going through the procedure? If she can find different set of parents and if she's okay with the surrogacy process, then why not? But if she does not have any other channels to resort to, then I don't think she's bounded to go through the process.
What about the other?
Sir, I agree with Mansi. It depends on the woman how she wants to go about it, and I think that's what the law states as well. There is no need for the father or anybody else to be in the picture. A woman can abort by just her decision, and I agree with that.
So
Anybody else?
so
I'd say that basically the thing is that in my understanding, finances are definitely a point, and as we have already discussed, the emotional environment that a child gets plays a huge role in the child's upbringing. And if someone is forcibly conceiving a child and he's going to be in an environment where he's not going to be looked after or is going to face some major emotional adversities, he is going to grow up traumatized. And if you know that beforehand that you're not emotionally ready to conceive a child, to raise a child, I think it's better that that human is not brought to life just to go through suffering. And secondly, financially is definitely, the financial aspect is a point as well. But that said, I feel that a child conceived out of a wedlock or anything, I don't believe that the circumstances of the child being conceived matters. As long as the mother is confident and okay with the fact and she wants to raise a child, I don't think the circumstances matter. I think she can totally raise a child if she wants to.
Any counter
so like
views?
for abortion, so for abortions, I only have one point to make. Like, there can be family pressures, like in countries such as China, India, where female are not given that much priority and they long for a male child. In that case, the families may be pressurizing the women to actually abort the child.
Yeah, but
So that
sex
cons-
determination. sex determination is illegal. So we are just talking of an abortion without knowing the sex of the fetus.
Okay, in the early stages. Okay, if that's the case, then I agree with all of them. Like it depends on the circumstances, and if the person, like if the woman is actually okay with having a child, then it is totally her decision. Obviously, if it's based on marriage, then both the consent, I believe that the husband's consent also needs to be taken, since it's a mutual decision for the family to raise a child. Otherwise, if she wants a child and she desperately wants a child, then she can actually break up with the husband or something like that if no one is agreeing on the same
Okay,
to the same thing.
fine. Now let's change the situation a little. Suppose all the problems that you listed, they were not there and the child is born and it is a year old or 6 months old. Then what do you do? Suppose everything that you mentioned in favor of abortion was not there during pregnancy and the child is born. And then after 6 months, these problems crop up. Then what do you do?
For problems as in financial problems and all
All of
that.
the problems, all of the problems that you said because of which one could abort a fetus,
Yeah.
any of those problems come up after the child is born, and let's say the child is 6 months old or 1 year old or 2 year old, then what do you
Then a mother will when what will a mother do, right?
do? Yeah.
Uh,
So then the mother will have to equip herself with whatever she can to provide for her child. And I think it's also very biological that right after the child is born, the motherly instincts kick in. So I'm sure she will try her best and f- try her best to bring the child up with everything she can. So that biological instinct will develop and she will try her best. So it it may not be the best circumstances, however, the mother will be supportive of the child.
I
So,
completely agree with Ishita. Like when a woman becomes a mother, like she is the number one supporter and defender for the baby. So however the circumstance, a mother love won't change if they are rich one day and if they're poor the other. So she will in every way try to protect the child and raise to best of her abilities. And even if she's facing problems with her in-laws or societal pressures, she will have to step up. And we have seen scenarios where she has to leave her home. She gains the confidence after the oppression and she works hard. And even single moms are there who work full time and still take care of the child. So I don't think even then a mother would give up the child. Also, there are circumstances when women are so, some women are weak and they just know that they cannot support. So they try to give their babies for adoption and they give their babies to some old age home, like orphanages. So that also takes place. But I think to she would first try from her own capacity to save the child. But if she cannot, she might even give the child at an orphanage or for adoption.
so I think even though what you said is true for most mothers, I do believe in the fact that the motherly love never goes. But at the same time, I think we have seen stories where if someone is mentally unfit, and we see that sometimes people do get into a situation where you don't see that motherly love anymore for a child from a mother. So those situations are also there, no matter how rare they are. So that could be a situation. I think what also needs for us to answer this question, like the change of situation that is there, right? Because we were okay with killing a 4 week old fetus, but now that the person is in, like, has taken life, has taken birth, our whole sort of the perspective has changed. So I think what also needs, we need an understanding, a biological understanding of how developed a 4 week old fetus is that fetus mentally and physically, how developed it is exactly biologically. Because if I'm being honest, a primary assumption or a fact that I took into account when I was uh, basically supporting abortion is that a 4 week fetus is not developed, and it is at a point where it might not be completely unethical or morally wrong, because if a child is not developed, and you can basically stop that child from being born and to go through suffering, all sorts of suffering, that is one thing. But now that we know that child is 1 year old or 6 month old, it is, I think you can ask anybody, it is absolutely wrong morally and ethically. And I don't think anybody would ever say that, ever consider killing that child. So I think that factor needs to be taken into consideration.
Anybody else? Okay, fine. What all you said in the fetal situation as well as the newborn situation is what exactly I would have said around 25 years ago. So I happened to get a video cassette. That time there used to be video cassette. I happened to get a video cassette uh, of a documentary which is called Silent Scream. The Silent Scream. I think it is half an hour. And I used to be teaching in a college kind of environment.
Sir, I'm not able to hear you.
The Silent Scream.
The silent
So your
scream.
voice is patchy.
Yeah.
I got a video cassette. You know, we used to have video cassettes back then, 25 years ago. So I got a video cassette of a documentary which was titled The Silent Scream. Now, this was basically about abortion and why it should not be done. And the great thing about that video was that uh, the person in US, the doctor in US, who had done the maximum abortion till then and who was very pro-abortion, he had done probably 7,000 or 70,000 abortions in his life. And he's saying that it is wrong. It is like killing. Abortion, aborting a fetus is like killing a person. And the video was not that graphic, but the explanations given there were so horrific, so sort of stomach curdling that none of the classes in which I showed the video could watch it for more than 3 to 5 minutes. So I think now it's available on YouTube if you feel like, but again, it's up to you if you want to. Just watch it. At least if you watch for 3 to 5 minutes, you'll get the gist of the matter. So that title of that is The Silent Scream. So there are a lot of things which we take for granted. We don't think too much about it because we see these things happening around us, but they may not be all right. Okay, this discussion was apart from the GD that we had. So anything else on this or the GD that we had?
So a counter to this point may be that, like, what if it's like a 13 or 14-year-old who has conceived due to a rape or something like that? Then in a situation like that, you can't justify not aborting.
No, I am not justifying either aborting or not aborting. I was justifying the voluntarily aborted,
Okay.
which were done not these kind of situations because pregnancy
Okay.
can happen due to various situations. So
Hmm.
I am also not justifying or denying that abortion could be done, but just to open up your horizons, open up your mind a little more, because we sometimes get closed because of what we see around us. That may not be the real picture because see,
Yes.
please understand. That is why the doctor whom I mentioned, his being in that film was very important because he was more than 70 years old when that film was made. And like I said, he had done probably 7,000 or 70,000 abortions in his life. When he says at that age that what I did was wrong, and it is actually killing a person, just like killing a person, then you wake up, you know. So it's just about sensitizing you to that.
Yes, sir.
Okay, any other questions? Otherwise, I would like to have a short interview with one of you who is having his interview in the next few days and on a particular area of the interview. So would anybody like to volunteer? you have your interview in the next 2, 3 days, 4 days, and any particular area which you are concerned about, then you
Yes,
can
sir.
do. Which part?
Sir, I think my introduction, the chronology of it, I think that really takes the interview wherever it has to go.
Okay.
Just the whole tell me about yourself. It really guides where the interview is going to go. So I want to just brush that up and take it up with you if what I'm saying is correct.
Okay, wait. This I'll just rejoin.